I want to welcome and many thanks to Governor Charlie Baker and Secretary of Health and Human Services, Marylou Sudders. You don't have to practice Health and Human Services in the mirror to get it right. Anyways, I want to thank you guys for choosing us to make this announcement. I mean, this is really important, and we're truly humbled by your presence here. Many thanks to our legislators like Russell Holmes for their continued work. For his continued work on behalf of our patients and the community. To our community partners like Tom Sands, President and CEO of Kearney Hospital. Mike Puzo for Project Right, Dr. Mandel from Stewart Healthcare Michigan, and other CEOs who are here today. Special thanks to the clergy that's in the house. Community leaders like Bishop John Borders, who's my faith leader at Morning Star Baptist Church, and Bishop Dickerson, who leads Greater Love Tabernacle. I'll tell you, faith-based leadership and presence is invaluable, especially in serving to the underserved. Welcome also to Jim Hunt. Please stand, Jim. He is the president and CEO of the Mass League of Community Health Centers. His organization represents and serves the needs of our 52 state health centers. Jim's guidance for me personally has been invaluable because I didn't start off necessarily in the healthcare space. So his guidance, thank you, Jim. Massachusetts Community Health Centers provide a broad range of primary and preventive care services to more than 1 million people in the Commonwealth. Here at Harvard Street Neighborhood Health Center, we are in our 50th year of addressing the physical and behavioral health care needs of this community. We provide accessible, high-quality care, and over the years, thousands of patients have benefited from our comprehensive health care services. Our services include dental, which is over here, eye care, nutrition, pharmacy, pediatrics. We also pride ourselves on our uniqueness, as we are one of only 10 health centers that have a full-service veteran center. Our veteran center facilitates access to much-needed social and health care needs for our veterans. So access to comprehensive quality health care service is an important part of promoting and maintaining health, preventing and managing disease, and achieving health equity for all Americans. That is why Governor and the Secretary are here. They're here today at the Health Center because they understand the power of primary and behavioral health care in improving the health and well-being of patients. As a result of that, they're lowering costs across Massachusetts' healthcare system. As the governor has said, this bill effectively flips the script on healthcare by investing 30% more in primary and behavioral health care for patients. This is critically important to the patients we serve. Patients who are 3 or 4 times more likely to be impacted by chronic diseases. These diseases include depression, or to struggle with substance abuse disorder, or experience significant trauma as a result of violence or abuse. Add to that the negative stigma surrounding access to mental health services, especially in the Black community, and the problem is exacerbated. At Harvard Street, as we can see, as you can see by some of the renderings in the back, we are co-locating and integrating our behavioral health services within primary care to try and overcome that stigma. As community providers, we are increasingly expanding our capacity to provide a host of needed services in our community. That said, as a result of keeping patients engaged in primary care and less reliant on expensive emergency hospital and specialty care visits, Massachusetts health centers have generated annual savings of $2 billion for the Commonwealth. That's huge. Harvard Street Neighborhood Health Center alone generates about $9 million in savings to the healthcare system while providing a $13 million economic boost to the surrounding community. So we not only increase access to care for a vulnerable population, we decrease the cost of care and increase the economic well-being of the communities we serve. Ironically, even as health centers improve the health of their patients, and they are very difficult patients at times because we are serving a very vulnerable population, and even though we generate quite a bit of value in serving that population, our model, or health center models model for providing accessible care puts a heavy strain on the finances for health centers. We operate on very, very low margins. That is why we are grateful that in the governor's bill that they've also established a trust fund for community health centers experiencing financial distress. Thank you, Governor Baker and Secretary Sudders, for these important investments. And with that, it is my utmost pleasure to introduce to you the governor for this great Commonwealth, the Honorable Governor Charlie Baker.
Let me just start with this. If you talk to almost anybody in any community in the Commonwealth about the state of our healthcare system, it will always come back to the same key theme. They will talk about the lack of access to mental health and behavioral health services. They'll talk about the lack of time to spend with their primary care provider or their pediatrician or their family practice doc. They'll talk about the difficulties associated with providing a holistic approach to the services that their son or daughter or brother or sister or mom or dad or husband or wife might need in dealing with a co-occurring issue with respect to behavioral health, addiction, and other services. And the reason they'll talk about those things is because we have a system that for decades has been built on transactional medicine and technology. And you need to go no further than the opioid epidemic to understand that. It was much easier for decades to write a prescription for pain than it was to figure out a way to get reimbursed to provide the time and the therapy and the mental health and behavioral health services that somebody might need to deal with the core source of their pain or their problem. And that's why we're here today, because the legislation that we filed and the hearing on this legislation is on January 28th at the State House. I would like everybody who believes we need to invest more aggressively in primary care, community-based services, behavioral health, and addiction services to circle that date on their calendar, January 28th at the State House in front of the Healthcare Committee. Because that's when we're going to have a chance to make our case for a Commonwealth in which over the course of the next several years, we invest on the provider side and on the payer side significant new resources in righting this imbalance that exists in our current system to deal with the gaps we have in behavioral health care, primary care, addiction services here in Massachusetts. Now, I almost never talk to anybody who says to me that they don't think that's a good idea. And they've been saying it to me for 20 years. And for 20 years, I've been trying to figure out, if everybody thinks this is such a good idea, why aren't we doing it? And the answer is because we are pushing against a platform, a system, a model, a set of policies, whatever you want to call it, that undervalue, time and therapy, and put tremendous resources into transactional medicine and technology. Now, I have no problem with transactional medicine and technology. It's solved a huge number of really important problems and challenges. But if you talk to anybody who's dealing with the healthcare system, they will tell you that that focus over there has come at the expense of what the current patient population and their families worries about most, which is the lack of team-based approaches to primary care and behavioral health care and addiction services, the lack of a focus on and support for time-based therapies, and the constant winnowing away over time of our primary care and behavioral health infrastructure. When I talk infrastructure there, I mean like human beings. You look at the healthcare system in most other countries, and 50% of their providers are in primary care and behavioral health. 50, 5-0. In the US, it's more like 15 or 20. And that is purely a function of the way we choose to fund the system. Now, since we filed our legislation and said we want to see a significant increase, a big nudge, a big push, something very close to like a requirement, that the payer and provider community dramatically increase its investment and its support for primary care and behavioral health services. And as I said, I haven't met anybody who thinks that's a bad idea. And I've talked to a lot of people who think it's a good idea. But we still have to get the bill passed, and then we have to implement it. And this is a departure from the status quo. And anytime you move away from the status quo and push a change-based approach, you're going to bump into the status quo, which has been with us for a really long time. So I can just tell you that for me, and for Secretary Sudders, and the folks on our team, we're going to spend a lot of time with folks like my good friend, Representative Russell Holmes, and other folks in the legislature, and with folks like Jim Hunt, and with Stan, and with a lot of the people we know who get the fact that we have a problem that we need to fix with the way we fund and organize healthcare delivery here in the Commonwealth. And we have as much momentum to move in this direction as I've seen in my career in this space. But we're still talking about a dramatic change in the way this has worked. And it's going to be important for all of you who believe in community-based approaches to healthcare, to the notion that we should be investing more in primary care, to the idea that we should be investing more in behavioral health care, the idea that we should be delivering on a system that actually reflects what the patient community and their families are looking for to serve them. Now, Secretary Sudders and I spent with our staffs almost a year putting this bill together. It's 179 pages. Every word has meaning. There are summaries available. It deals with a lot of other things. It deals with scope of practice issues. It deals with parity issues. It deals with pharmacy pricing. There's a lot of stuff in there. But at its core, the goal here is to change the way we think about and support primary care and behavioral health services so that instead of having organizations literally scrambling day after day, week after week, month after month, year over year, to meet the obvious concerns and circumstances of their patients, that we have a system that actually rows in the same direction as the patient community does and as this kind of care delivery system does. And it's going to be a lot of work, but with the help of folks like you, I absolutely believe we can get it done. And I want to turn the mic over at this point to my co-conspirator in this, Secretary Marylou Sudders.
There's a new job description, co-conspirator with the governor. I actually like it. It's so good to be back at Harvard Street Neighborhood Health Center. I have to tell you, when I walk in the doors, I want to be a patient here because I want to give a shout out to the staff. From every person. Meet you at the front door, the facility director. I mean, just look around. I know Stan is dreaming big for that new health center that has housing. But what you have done with this building to make it respectful, welcoming, and opening to people who come through these doors for health care, you just have to feel good about that. The reason the governor and I wanted to be here at Harvard Street as we really start the campaign to discuss the 179-page healthcare bill that the governor has filed is because health centers to us actually embody what we are attempting to do through legislation, which is at the heart of a community health center is primary care. At the heart of this health center is primary care and integrating behavioral health care and transferring that trust of primary care to behavioral health if there's some other issue going on with patients that you're privileged to work with. That is one of the reasons why it was so important for us to be in a community health center as we start our community conversation about the governor's health care bill, because health centers embody that, one. Secondly, a piece in the governor's health care bill, and it is big, it's 179 pages. When my friends in the legislature say it's 179 pages, I point out that our last big health care reform was more than 400 pages, so I'm thinking this is like the short version of health care reform in Massachusetts. There's a couple of other provisions we wanted to talk about today, and one is health centers. So one of the pieces in the governor's health care bill is a reserve fund for both independent community hospitals who don't have the same leverage as our academic medical centers to really compete in terms of prices and the like. And a piece of that is for community health centers. Two pieces. One is, as Stan said, the margins of community health centers are thin and a number of struggling. So we want to ensure that there is a dedicated funding stream for health centers who are struggling. And then we also propose a sort of a little innovation pot, if you would, for those centers who are trying to integrate primary and behavioral health care. So extra funds in order to sort of help bridge that. Because there are sometimes barriers, whether they're physical barriers in terms of physical plants, or sort of the cultural barriers in terms of primary care docs who don't quite have the mental health and behavioral health language, or for some of the behavioral health folks who don't quite figure out like around the blood pressure and the rest of the stuff. So really bringing it together. So that was the piece. We wanted to talk about the importance of the governor's health care bill, really investing in primary and behavioral health care within our overall health care cost benchmark. That's one big piece, and that's why it's important to be here. Second is the reserve fund specifically for independent community hospitals and our community health centers, because we acknowledge how important community health centers are to our community's health. And then the third piece is to talk just briefly about scope of practice and nurse practitioners. Any nurses in the room? Just in case anyone was, there's a special bond of social workers and nurses. Nurses, our nurse practitioners, Massachusetts is one of the most restrictive, limited scopes for nurse practitioners. You are trained to do so much more than we allow you under current state law. And so one of our things really around expanding access for primary care and behavioral health care is to allow our nurse practitioners to really practice at the level of which you are trained. It sounds simple perhaps, but again, we are one of the 8 most restrictive states in our country. It's not one of those places where we lead and we think of ourselves as healthcare leaders in Massachusetts. So one of the things we want in the governor's healthcare bill that passes is to allow our nurse practitioners to practice at the top of their license, and in so doing, right, it creates more time and access for the rest of us. So we're here to, first of all, just thank you for what you do. We understand by coming, and we did think about it, Stan, is like how disruptive it is when we come. But for us, being here with you on Blue Hill Avenue, for us is the heart of why healthcare is so important in the Commonwealth of Massachusetts. It is time for our healthcare system to put the patient first and foremost in our healthcare, and that really is the heart of the governor's healthcare bill. It is you, me, all of us together as patients, and what we want when we need help is it's our primary care physicians. It's access to behavioral health in a non-stigmatizing way, and it's being with all of you. And you know, just as a final note, my roots actually go back to Blue Hill Avenue. So I worked across the street at Franklin Park in the 70s. So I am not, I know the buses up here, up on Morton Street and the like, changing at the buses in Eagleton Square. So I was thrilled when the governor said, yes, we're going to start this campaign for healthcare reform, Baker 2.0 in Blue Hill.